Hiya, I'm Luna, and Merry Thankmas to all. Uh, monthly. I apologize, I intended to make this channel and do all this video production, introduction stuff several months ago at this point, but the bugs don't really care about your plans. That being said, despite the lateness, I still wanted to tie this back to Thankmas 2024, not just for this fabulous image of Jack right here. I think the YouTube logo on top kind of makes it funnier. But on top of that, because of the mental health focus this Thankmas had, and for people who are out of the loop now or far in the future, Jack around this time had done a good job telling people about his diagnoses, talking about medications. I mean, Mark did too, but Jack was really in the forefront of that and really hit it home this year. So for that, in case Jack ever sees this, I say thank you. Thank you for making us more visible. Thank you for showing that you can be this big hero, big channel, despite, or maybe even in addition to having these sort of disorders. And thank you for making it more normalized, even to the people who are not within the medical sphere, not having these sort of disorders. Because hopefully that will lead to our generation actually being able to talk about medical issues, unlike my parents' generation, where getting any information, even about my own medical history, is like pulling teeth. Ugh. So, preamble aside, I want to, thank you again, Jack, and move on to why you need to be treating your PTSD and anxiety, using my own personal experience. You see, I was never the type to focus on that as hard. I always, by the time I had my own insurance and I can go for it, the mental health component always was pushed to the wayside for other medical issues that just seemed like they were in the forefront. However, in that same breath, I ended up ignoring certain factors that ended up becoming complex regional pain syndrome. For those who don't know, complex regional pain syndrome is an overreaction of the body of sorts. It usually is linked back to the trauma rather than a specific injury. I pull up this Delmarva article on this specifically because it brings up the traumatic part. And while it lists like car accidents, sports injuries, my pain doctor was telling me it can just be the PTSD manifesting itself. And this can be brought into physical symptoms. Like, I'm sure by this point you've been seeing my hands waving around. You can see the difference in color. Think of it as a extreme form of Raynaud's, if you know it. Well, with the blood and circulation, there's an issue there that keeps all the heat in the core and doesn't let it radiate out. Normally with Raynaud's, you see it when you're going out in the cold and whatnot, but that's just a lived experience. And I know it looks weird with my face, but I am also wearing a layer of makeup that uses a pink blocking component, which is also a difficult thing to consider here. And the one time I tried to match hands to face makeup, like you're technically supposed to, what they tell you, I looked sickly, to say the least. moving forward with that, I also have very common 9 out of 10 pain. The spasms, the muscle fatigue you saw in my intro video, those are we're thinking those are part of that too, but of course I'm still doing other tests for it. However, it is a commonly linked thing here. And all of this stems from PTSD and that sort of paranoid anxiety not being treated well. I did not go to therapy. I did not seek out a psych until it was way too late. And I understand not wanting to go to therapy. It doesn't really help me either. However, I have found if you can find yourself one of those doctors who is both a psych and willing to do some of those talk therapy type deals, it is easier to do so and more effective in my eyes, because there is a means to an end. Like, this can lead to getting prescribed medications, getting to talk about different other issues that can link back to it. And well, when it comes to showing all that off, being able to have both there, it's a lot more helpful than feeling like, I'm just going to spend this money, how expensive it is, talk to someone, and that's it. Now, that is not to say that I recommend having them prescribe some medication. You go with it wholeheartedly. No, these sort of topics, there's two components here. If you're not comfortable, you shouldn't do it. If the doctor's not comfortable, you should talk about other ways to go about it. And then on top of that, I would say just in general, in terms of medications, you should really go with a lowest possible for as long as possible. That's not to say that you should, like, if you're going for quetiapine, for example, stay at like 25 milligrams. That's not quite a good idea, mostly because when looking at anxiety when it comes to quetiapine, the starting dose is a lot higher than the 25 milligrams because the lower doses are really there for sleep. It's something that's prescribed for sleep as well. I use that as an example because I was recently put on that after we were put into a scenario. I was talking with my psych. I actually was in the middle of a paranoid anxiety sort of, I'll call it an attack. I honestly don't remember how much that happens, but I remember from this attack, I remember think of it as weird because normally it's cyclical. Even though I don't remember all the cycles, my brain's just pushing that off. And that's another reason why you should be seeing a psych, playing around with the different times you talk to them. Because it's very possible. Like, PTSD is known not just for remembering everything, but there's also a different sort of form where it'll eat up your memories, for lack of a better term. And it just blocks out parts that would be really helpful for you to be able to discuss. Now back to the medication issue. I would like to present a tool that is very helpful, I've found, so that you're able to pull it up quickly, read some information, so that in the case where you're in the middle of an attack like I just described or something similar, you can very quickly pull out information about certain medications that your doctor brings up. This is drugs.com. I know drugs.com sounds like the stereotypical, oh, that's where you buy the drugs, right? No, it's actually a very good tool. So say you were talking with the doc about buspirone. You can search it up, click right in. It gives you an information about what buspirone is, some things you would want to know before getting on it, different side effects you can think of. Personally, I prefer to do this on my phone because when you get to a certain point, more about buspirone, it actually shows the interaction list within the site itself, which is also very important to keep in mind because, for example, I am also taking duloxetine. And from this, there's risks of heightened serotonin syndrome, which I know I'm already very susceptible to, as well as increased risk of seizures, which is very much not a good idea when you live alone, well, with your doggo. I was down there. Well, anyway, that was actually one of the ones we had discussed before I went with the quetiapine now. And it was actually these interaction risks that I pulled up on drugs.com, and we had a good discussion about that made us go, maybe we should discuss some other options. Now, I know you would like to think that your doctor knows everything, but that's never true. The people who are supposed to keep all the interactions in the back of their minds, those are the pharmacists. And let me tell you, it is a lot easier to have something pull up interactions, talk about that when you are nervous about something or don't want to mesh different medications, than it is to have the pharmacist warn you about, oh, this is a really big interaction, that may not be a good idea. You then call your doctor. Hey, let's look at different ideas. The pharmacist says the buspirone would not be a good idea with my duloxetine. And maybe they'll be like, oh, we'll actually have to schedule another appointment for us to talk about that in more in detail. And that's really just a broad range that I'm talking about there, based off of interactions I saw. I mean, I was a pharmacy tech for 2.5 years before I physically couldn't handle it anymore. I have seen stuff like this happen. And I know it's also difficult to keep in your head with all these different names. But really, if you're gonna take them, you really need to know the names. You need to know the names. You need to know the dose. You need to know the instructions. And you have to be very clear about your not really your pronunciation, but if you can spell it out, you should be able to spell it out. So let me tell you, some of these names are really, really close to one another. And you don't want to accidentally be taking hydroxyzine instead of hydrochlorothiazide, for example. I know those names aren't as close to one another as you would think, but when it comes to the pharmacy, putting in Hydro 25 can give you some which is common practice back there, can throw you into a big loop if you do not play that right. So you need to know on your end, just in case one of those errors pull through. The whole point of the pharmacy is to have all these different layers and slow things down. But even so, something like that can very easily slip through the cracks. In fact, that example that I just gave you, the hydrochlorothiazide versus hydroxyzine, was an issue I noticed in the post-fill audit stage. Specifically, that's the stage after something was filled. At that point, it very well could have gone out to the patient by that point. But I was able to grab it, fix everything. Because really, we're all human. It can happen to any one of us. Now, with all that being said, let me know if you want more content surrounding these ideas of being a perpetual patient, being a pharmacy tech, if you want more details surrounding my complex regional pain syndrome, my PTSD, my anxiety. I'm very willing to go into more detail. I hope by at least putting that out there, showing you this tool that really I pulled out in the middle of my last psych appointment, and it was just like we were just more efficient in being able to discuss these different issues. Well, let me know if you want anything else like that. The subscribe button is down there, comment section is down there, and please, this is going to be the first video I post besides the intro, because it's the most important. No matter if it's seeming like you have to move around money, no matter if the insurance is going to be weird about things, I can tell you it's so much better to get that treated, be moving on with your life, being able to work the jobs you want, being able to keep up the pace and not have to feel this physical pain and inability to even sit up for long periods of time. I mean, these videos have been hard, but I think they're important. And Jack, if you're watching, thanks again. I hope you can spread this sort of knowledge as well, or maybe you could find it useful. Because really, the cost of not getting your PTSD treated and getting complex regional pain syndrome, for example, to hop around your body until it's everywhere, is so much more than the fees you pay for your psych every month. I thank you all again, and I hope you have a good day.